It's true, 8 of our people have been killed and more than 1,000 humanitarians have been killed the last year of this war, 1,000. Of course, running out of words because it goes beyond our imagination to understand the situation in Gaza today. A rough estimation says that we need to urgently evacuate approximately 14,000 people. And this is just the surface, the tip of an iceberg of needs. We expect from the world now to go back to the basics, to defend humanity. Because otherwise, can you imagine what's going to happen?
Can you provide an overview of the situation of the healthcare system in Gaza? And do you still have access to north of Gaza?
Of course, running out of words because it goes beyond our imagination to understand the situation in Gaza today. From a purely medical point of view, it is very indicative to see that this right moment, out of the 36 hospitals in Gaza Strip, less than half partially function. Very, very few are still functioning. And at the same time, many other small facilities, primary healthcare facilities, are not accessible by the people. We don't have the supplies, we don't have the painkillers, the antibiotics. My personnel and all the people working inside these facilities, they beg for syringes, they beg for bandages, and we don't even have the fuel to run everything as we would like. And when it comes to accessing all the people that they need it, we cannot. Nobody is safe in Gaza, and they cannot reach us because even hospitals are not safe. Hospitals have been systematically bombed. When it comes to northern Gaza, things are even worse. We don't have access. We hear stories from our people that they have remained there, but we are not, as MSF, able to move with our medical supplies in northern Gaza and support those people that they are still stuck there. These people have very important needs and urgent needs. We have amputations, some of them multiple amputations, and they need intensive care. They need reconstructive surgeries. They need several different interventions that we cannot provide them there. So there's a huge need for massive medical evacuation, and we cannot do that.
Are you able to bring in any medical supplies? Are you able to bring volunteers, doctors, nurses, or is that completely banned?
At this right moment, we have more than 900 Palestinians working in our facilities, and we bring in and out people that they replace others, what we call internationally mobile staff. But these are very few. Problem is not bringing people. Of course, we would like to be able to bring more because our staff is overwhelmed, is super exhausted, and they really have gone beyond what we call the burnout. It is indicative to share with you stories from our people that they may have lost members of their families and very close members of their families, and the very next morning they are back there to help others because this is the only thing that it was left for them to do. And I'm sure that they will be there until the moment that they collapse next to the patient's bed. So this is the situation with our staff, and our staff do their best, but they don't feel safe.
Based on your field assessment, what are the most urgent medical needs for children, especially that children in Gaza have the largest percentage of amputation in the entire world? We're talking about newborns, we're talking about mothers in need of maternity care.
A rough estimation says that we need to urgently evacuate approximately 14,000 people. They have needs that cannot be met in Gaza and with the current facilities at the moment. Out of them, children with multiple amputations, children with cancer, and this is just the surface, the tip of an iceberg of needs. We don't have all the visibility on what is happening with invisible diseases that they never come to a hospital, either because there is no hospital or because they cannot access it. And there are so many other problems and so many people that unfortunately die in their, I don't dare to say homes, in their tents these days. So yes, we need to evacuate, and these, I talk about medical evacuations, all these people, but unfortunately out of the 14,000, as I mentioned, very, very, very few.
What's hindering the evacuation of those patients?
There's a series of impediments there, and they are not just bureaucratic. I think there's no strong willingness by the Israeli defensive forces to let us evacuate these people.
8 MSF staff members have tragically been killed, and some of your facilities have been targeted. How do these attacks affect your ability to operate in the Gaza Strip?
It's true, 8 of our people have been killed, and more than 1,000 humanitarians have been killed the last year of this war. 1,000. How can we ensure to these people that they are safe to go out there and reach those that they need us? And this is our everyday struggle to negotiate access, to be able at least to guarantee that there is the basic safety. But I'm afraid that we don't get this. We don't get, and we will keep trying, and of course we will never abandon all these people, but it's getting extremely challenging and difficult to provide the basic humanitarian aid. And I'm afraid that this is a worrying trend, because we see that in Gaza, but we see also these attacks in several other places in the world. So it is important to understand that when there is an attack in a hospital, when there is a killing of a healthcare worker, it's not just the cost is related to one life. There are many other lives that they depend on this hospital, that they depend on these facilities. We have to understand the consequences are heavier, bigger, and longer term than what we see today and every day that another hospital is bombed or another of our colleagues is killed.
The world seems to have largely normalized Israeli attacks on healthcare facilities. What are the ramifications of this normalization in other conflict zones, other war zones, and what can be done to restore the protection status of medical care facilities under international law?
What I see is a pattern, is a worrying trend. And attacking the medical care has become something that is increasing, and at the same time it seems that it's been tolerated more and more, and there's no impunity. There's no accountability. We carry examples recently from Ukraine, in Gaza now, also in Sudan, and before that in Yemen, in Syria. And we keep shouting out loudly about this, but I'm afraid that we have reached our limits, because as humanitarians, we cannot really fill this void that has been created there by the failure of the politicians. In other words, it is not us that we can defend the international humanitarian law, the laws of the war, which is the only framework that we have that enables us to be there and provide the humanitarian aid. This is not a humanitarian's job. This is not our mandate. We need that to be provided to us by all warring parties everywhere, both states and non-state armed groups. And in order to do that, we go back to accountability, and accountability has to be equally given everywhere. Maybe we saw that in Ukraine when we saw these atrocities happening. We didn't see that in Gaza. How are we expecting now to go to Sudan and ask from the warring parties to respect things that others have not respected, and the whole international community did not react? So when I zoom out and I look at the world and I look what is ahead of us, I'm extremely concerned that this future in the humanitarian war will be really dystopic. All these people out there, what they expect from us and the international community is to respect them and to look at them as human lives, as equal human lives, that they deserve what we all ask for ourselves. They don't get that. They don't get that in Sudan. They don't get that in Palestine. We know that everyone out there are looking at us, and maybe they look at us as a last resort of hope that they should never lose. If they lose the hope, that's the end of the thing. That's why I think humanitarians, medical humanitarian organizations like mine, doctors, that they are there standing by the people, holding their hand and say, you won't be alone, we will be together. Maintain to them this hope, and this is the least that they can get. We will never stop doing that. We will never abandon them. Is this enough? No. We expect from the world now to go back to the basics, to defend humanity, because otherwise, can you imagine what's going to happen? We will tear apart the whole planet by this. We cannot let this happen.